Thank you, Aaron. Welcome, everyone. Thank you for taking your time to listen tonight of what I think might be the most important talk of the year. Not necessarily that it's, it's just information that has been overlooked or mispresented over a lot of time. And it may be the key for you or your patients to be getting better. Now, in about 5 minutes, I'm going to start with Dr. Metier, but I want to tell you a few things. You don't want to miss tonight's subject, which is NAD and the nuances of what NAD is and what it isn't and how to get it into your body. But first, I want to say here are a few things have been going on here they're quite interesting. And the first one is I just spent the weekend in D.C. Taking education on a new treatment for Lyme, which is nebulized, and that's called in treatment or in Lyme treatment. So it's a nebulized approach using a potassium iodide molecule that you may want to know about at some point. So it's very expensive. It's from Largo Bioscience. I guess they must be in Florida. Another thing is that we had a very successful time in August with Dr. Metier here, and we had Heal the Healers. So we had a number of people, number of doctors come, and we decided that doctors needed to know about this, and they needed the energy to continue to help all of you as well. So we had a weekend of 8 doctors and some other staff, and it was a beautiful weekend. And so it was just, they needed to come and see and feel and experience, and so they did the treatment. And I will tell you that in that group, there were people with, chronic myeloid leukemia, which has improved. There were people in that group that had anxiety and gut issues. Between that, a little bit of juicing, which we used some celery and parsley, we did a very good job at kind of stopping the significant diarrhea. You start naming it, it's just been so astounding that I can't even process it all. And what has happened here in the clinic this year should be regarded as something new and important, because I don't know if you've noticed, but life has changed and we need new ideas and new ways to treat people. So one of those key issues, and you've just got to get here and check out our NAD IV Center. And so one of the key issues in success in about 70% of our people is trying to understand how to build cellular energy. You know, there is one other marketing team out there that says something very similar to, without cell health, there is no health. We believe that. We just don't know what it takes to make a cell healthy yet. I think the world is still trying to figure that out. So that's where Dr. Metier came in. And sometime this spring, I started taking NAD IVs because, well, I'm not really sure why. It just all of a sudden showed up in our lives, in my life, and it changed my life like other things have. And for some reason, 4 years ago, I did have a patient say, you know, you and Dr. Richard Metier ought to get together. And I say, you know, I've never even been to Louisiana. So that was my comment, I think. So so I went down, and Aaron and my team, Dr. George, that's what I'll call him, Dr. George and all of us went down and studied with Dr. Metier. And we came back and started putting the principles of what he taught us together. And it has been nothing short of astounding. Instead of 3 out of 10 people getting better, 7 out of 10 people are moving forward. So that's what we'd like to convey to you, that without cell health, there is no health. And with Dr. Metier's wisdom and long-studied, you know, he always says to me one thing: well, my main concern is the study of this molecule called NAD. And when we start to look at it, it crisscrosses with everything and may be the key to health in the 21st century. So without further ado, Dr. Metier, I would just like to say welcome and thank you for coming.
Well, thank you, Michael, for the opportunity. This is definitely weird for me. I have not done this before, talking to a computer, knowing that there are a bunch of people out there listening. So I'm happy for people to interrupt me and so forth, because sometimes this stuff gets a little pithy, and I really didn't major in biochemistry, and if it, I want to try to clear up any confusion any of you may have about it. So I'm going to start with let me just say a little bit about what we've been doing. I've been working with this molecule in the addiction arena. We began using it to detox patients from anything, whatever, heroin, fentanyl, all kinds of opiates, crystal meth, GHB, bath salts, all kinds of things, seeing really things that you don't see clinically anywhere else. It helps a great deal with craving reduction, tremendous craving reduction, and it helps with mental clarity, at least in patients that are addicted, and it greatly reduces their withdrawal. But then others around that were working with us began to use it in other modes, and we've seen, you know, some really interesting clinical responses to PTSD, really reducing a lot of the hypervigilance and the nightmares and so forth associated with PTSD. It helps with, we've had some patients with Parkinson's come through that have gotten a response. Not everybody, but some of them have definitely gotten a response and are continuing. We've had a couple of Alzheimer's patients get a response, and others around the country are beginning to use it with, there's some RSD, reflex sympathetic dystrophy patients, you know, chronic fatigue, fibromyalgia, a variety of things. And I'm moving more into the research realm. We now have a research facility. We're measuring NAD levels at our facility, and we're working with a lab in New Orleans to measure those levels in clinical tests. We also have a relationship with an Australian group that have been working with NAD since the 90s, early 90s, and we're working with them, and we've just completed a pharmacokinetic study looking at NAD and the biomarkers associated with its response in a group of about 11 volunteers. It was a double-blind, placebo-controlled study, and the report that will get reported hopefully within the next 3 months. I just spoke with them a little while ago, and the technical aspects of getting NAD measured, they're in a line waiting for a specific machine, the use of a specific machine in order to measure it. So there's a lot of technical aspects. But anyway,
Dr.
Yeah.
Mediate, is it true that, I mean, NAD has been around since 1960, and it's been in high use around the world, and it's just still somehow new to the United States?
Yeah, well, actually, it was probably first used by Abram Hoffer in schizophrenics in the late 50s. It was called BPN at that time, a different nomenclature but the same molecule. And then a fellow in Oregon or Seattle, O'Halloran, he began doing studies with it, sponsored by Abbott Labs, and he did a fair number of patients. He was again using it for addiction, and he patented a use patent for alcoholism, treating alcoholism, substance abuse, drug abuse at that time was opiate related, and also in schizophrenia. The patent kind of shut things down, and it's a cumbersome procedure. It kind of got lost to, I guess, the South Africans began to use it in the late 60s, maybe early 70s, and they did a lot of the research, but they were under apartheid, and a lot of that research didn't get communicated with the rest of the world. And we learned about it from a guy in Mexico who was using it, again, in the addiction arena. And I began studying, once we understood what it was, began studying it, doing the research on it, and got volumes of articles and papers and so forth that I'm happy to share with anyone about it. But let me, any questions, or are people able to ask questions, or they have to write a question?
They're not ready yet to ask questions, but I think I find it interesting that at this juncture, the reason I became attracted to it was just what you said. I actually met Abraham Hoffer probably in 2001, and he was about 86 years old. And the one thing he used to say, nobody dies senile in my family. And he took about 2,500 milligrams of this type of vitamin B every day. And so that was his claim to fame, and that I mean, he really. And one of the words that was so impressive is how many people in the United States recover from schizophrenia? Almost nobody. How many people in Canada did when he treated them? It was almost everybody. So it was quite an interesting awakening, but there was no way at the time. You just gave vitamin B that made everybody flush and turn red.
Yeah, so, well, this is a coenzyme of niacin or vitamin B3, and I think it was, vitamin B3 was discovered in relation to the pellagra epidemic in the South, where there was not in the Depression days, there was not niacin enriched corn or any kind of niacin enriched, and there was no meat, and people got very much vitamin B3 deficiency. But NAD, I think, is a heavy lifter in the response when you give niacin. It cured there was a dementia, a dermatitis, and a diarrhea associated, a GI disturbance associated with that epidemic. And that's how vitamin B3, niacin, was discovered.
So why don't you go ahead and tell us more about NAD on your slides here and tell us how it works then.
Can we actually talk a little bit about how the this NAD is different than the NADH? And,
I'll
clarify the difference between this and an oral.
Yeah, basically NAD, it's a coenzyme. NAD is I guess the main substrate, and then it picks up a hydrogen ion, which is why it does so much in its redox activity, and then it becomes NADH, and NADH then goes into the electron transport, gives up that hydrogen, and with a lot of cofactors and so forth, and that produces ATP or cellular energy. So NAD starts the process, NADH sort of delivers the hydrogen, so it's really a transfer of hydrogen from one area to another. And for instance, in alcohol, when you drink ethyl alcohol, you give off about 3 or 4 hydrogens in the process of it going to produce food or energy. And those hydrogens are only taken up by NAD. So NAD starts the project. The prospect goes to NADH, and then it becomes cellular energy.
So by supplementing NADH, we're not really getting to the right place, because that's what's behind this question. We've all tried to do NADH for years, and every once in a while we get a boost, but it's a very delicate molecule, and the ratios between NAD plus and NADH have to be just right for all that to work. And if you're just giving NADH, you might not get the effect you want. Is that true?
Well, that's the way I would see it. I mean, there's a guy named Berkmeyer in Austria who focuses on NADH. But what we see is that when there's a lot of stress, oxidative stress, or when somebody's drinking a lot, their NAD levels are down because they're using it to metabolize the alcohol. And the ratio of NAD to NADH shifts. So if you took NADH, you really have to convert that back to NAD, which is more cumbersome. It's better to raise your NAD levels and get your ratio of NAD to NADH more normalized for the NAD activity to work.
And because of many people that we serve with Lyme disease and Alzheimer's and Parkinson's and early Alzheimer's and those type of things, their body is already, even though they don't drink alcohol, intoxicated from either ammonia or aldehydes or other things like that. So they seem to, we saw it while you were here, where people's intestines sometimes needed to repattern or get reset and get the GABA receptors reset because there were so many opioids on their intestine, self-induced.
Yeah, well, when we're treating a heavy opiate user that's been using heavy opiates for 10 years, they're very sensitive to the NAD. This is just some differences we see. And it's because their opiate receptors in their gut have been corrupted. And so the NAD is not as easily tolerated as, say, the alcohol person. They're soaking up. In fact, we have an alcohol patient right now who's just, you can run at full speed. And that's not something you could do with an opiate patient. So there are differences there. Let me show you the molecule to folks. Let's see. There it is. It's a large molecule, and there's debate about, does it get into the brain? How does it cross into the cell? All those kinds of things. We're still dealing with that, but we know it gets into the brain, or something gets into the brain, because of what we see fairly quickly when we give our infusions. That's the nicotinamide portion. That's the adenine portion, and then the two nucleotides. And when we infuse IV NAD, we're still learning what happens to it. Some of it becomes precursors to NAD. Some of it becomes nicotinamide. This is all some biochemistry stuff. And but we have, in our lab, we've been able to at least demonstrate increased levels of NAD plasma after infusions, and increased levels of ratio of NAD to NADH in plasma after infusions. This is probably the most important slide that I have, and it puts NAD in the middle, because NAD is more than just a molecule to supply cellular energy. It's also what's called a signaling molecule. Its concentration is important for multiple functions. Any one of these functions I'm going to highlight would be significant in and of itself. But when you look at all of them combined, it becomes a little mind-boggling, and it helps us to understand why we see the clinical responses we see. First is energy production, as we've been talking about. ATP is the name for it. That's in the cell, and NAD is in every cell in your body. It's in every mitochondria in your body. And that's the battery source that produces the cellular energy, ATP. And that's just that in and of itself would be enough. It's also very critical in DNA repair. NAD levels are important to activate this enzyme there that you see called PARP. And when PARP uses NAD, it uses it up. When NAD is used in energy production, it's recycled. So we would say PARP is a NAD hog. It's using it. So some of the theories about why NAD is important as you get older in preventing aging is because there's more DNA repair that occurs as you get older. And so you need more NAD. And in fact, the Australians have shown, and others now corroborated, that your NAD levels begin to drop when you hit about 45, 50. And then they really go down when you hit about 65. And the thinking is that it may be because you're repairing more DNA and using up that NAD. The other important aspect is gene expression. This whole body of compounds called sirtuins. They are cell-promoting or health-promoting cells. They prevent cells from dying. Very important in many functions. And there's tons of research being done on each one of these individual areas. Another important function of the cell signaling is in the immune system. This is, I didn't become aware of this till last year, and this is gaining a lot of interest as well. NAD is very important, and I have a slide on that for CD38 function. CD38 is a protein that helps signal when there's an inflammatory process going on. It signals for the cavalry to come in and reduce the inflammation. But it is NAD dependent as well. There will be a lot more. There's a lot more about the CD38 story that we can talk about later. There's some evidence that it's probably a neurotransmitter. That work needs to be done a little more in depth. but there's some studies to show that it does act as a neurotransmitter. The other tremendous activity of NAD is called this, quote, redox cofactor, shuttling hydrogens from NAD to NADH. And another cofactor of niacin is the NADPH, and then NADP and NADPH. It also shuttles hydrogen as well. I'll be honest, I haven't studied that as much. There are the biochemists that have. I'm not really a biochemist, more of a clinician. So there's more to be learned in that area. You may have heard about telomere length being associated with longevity, and there's pretty clearly NAD is important in lengthening telomeres, and they have a slide about that. I'm going to move to, so
we can basically say that NAD seems to be involved in just about every important transaction in your body.
Yeah, and you know what? The image that I like is when NAD wakes up in the morning and says, "What am I going to do today?" You know, and you've got an infection going. Well, you're going to have to move it over to cell signaling, helping the immune system. Does that aggravate DNA repair at that time, or does that aggravate energy production? So if your levels are not adequate, you're going to have to borrow from somebody to do whatever the daily function is. And that's why I think it's so helpful to think in terms of keeping your levels up, especially after, say, 45, 50. Where does it come from? How's it made? The body needs to make it. You can't absorb it from the diet. You can absorb niacin, but niacin then gets converted to NAD. Every cell in the body needs it. Main precursors, these are substrates that go to make NAD. There's tryptophan, which is an amino acid. It's a protein rich in turkey and so forth. A precursor is vitamin B3. That's nicotinic acid, nicotinamide. There's a precursor called nicotinamide riboside, and there's another one called nicotinamide mononucleotide. All precursors that eventually lead to NAD. This is a little bit pithy pathways. There are two pathways to produce NAD. One starts on the left, tryptophan. It's called the de novo pathway, and it leads to NAD. And then there's the precursors of starting with nicotinamide riboside, nicotinamide mononucleotide, and they produce NAD. They're a salvage pathway. One interesting thing in this slide is that I'm going to move along a little bit. When inflammation is in the body, there's a switch that goes on, and tryptophan, which was normally going to make serotonin and melatonin, gets switched and goes over to make NAD, which we do see anti-inflammatory effects of NAD, both locally and when we give the IV. I'm going to move along.
Before you move along, that is after 5,000 autistic kids and 3,000 people with Lyme and Parkinson's. That is, in fact, exactly what they look like. We can show you that, and we might even talk to Bill Walsh. I think or what is his name? I can't think of his name out at Great Plains. But I mean, this is what we measured all the time, except for the NAD. We saw the quinolinic acid being a problem. We saw the tryptophan being a problem. We saw the just these same numbers. So this is all every one of my autoimmune neurological people. Okay, that's all I wanted to say.
Yeah. This kind of goes over the whole scenario. There's down at the bottom, there's a CX43, it's connexin 43. That may be the pathway that NAD gets into the cell. I think there's still some work to be done about that. This has, it's a pretty active slide. I'm gonna just go through it, and maybe there are questions later about it. Again, it brings in the PARP DNA damage, sirtuin activation, and the CD38 at the bottom. All right, how do you raise NAD levels in the body? There's some oral routes. Nicotinamide riboside has been shown to raise NAD levels. Nicotinamide mononucleotide, niacin, nicotinic acid, and nicotinamide. And then intravenous NAD. We have worked primarily with the IV NAD. We've used nicotinamide riboside. We have not used NMN. We've used niacin. And our focus has really been on the intravenous IV NAD. We just see better clinical responses with that. And there's been a lot more patients in the world that have been studied in relation to the IV NAD because it's basically started back in the 50s. You maintain NAD by reducing oxidative damage. I can show you some slides where the amount of oxidative damage you have definitely impacts NAD levels. So, you know, reducing oxidative damage, reducing oxidative stress helps. Reducing inflammation also helps to maintain NAD levels because CD38 needs NAD to activate its anti-inflammatory effects. And then you can increase by synthesis, which is through oral intake and IV. This is a slide on CD38 and inflammation. It's a glycoprotein found on the surface of immune cells. It functions in cell adhesion and signal transduction and calcium signaling. CD38 is encoded on a certain gene. It's one of the largest consumers of NAD. Again, it uses NAD to generate with calcium metabolites. An important role in inflammation, it causes a migration of white blood cells, neutrophils, those are monocytes, those are white blood cells, toward the sites of inflammation to help clean up the mess created by the inflammation. It also,
Dr. Metier, when I worked with Mary Megson early in autism, the idea of the calcium channel and the calcium mess, the calcium-sodium channel, with a genetic issue called something that inhibited G-alpha protein regulation of the calcium channel, this is exactly what we needed going in there instead of high levels of calcium and mercury. NAD was not present in that situation, so we couldn't push out the toxins or have the cell function, so there was early apoptosis. So this calcium expression is a big deal. So for most, again, neuroimmune issues.
Yeah, and also for pain issues, we've had some patients that come, I didn't believe them until they kept coming back. We had a patient come in for stress, and he had back pain, and his pain went away. Now, it doesn't go away for everybody, but there are some patients that get an anti-pain response. And we think it's probably through this mechanism by reducing inflammation through the CD38. Clearly, decreased CD38 is associated with impaired immunity. Conditions in which inflammation is increased, CD38 activation is a potential cause of reduced cellular NAD. So by increasing CD38 activity, you decrease NAD. Again, that's why you need to keep your NAD supplies up. There is a link between CD38 and autism, which I'm going to show you. And it's like this. Oxytocin, that's involved in social interactions, may promote trust, generosity, increased emotional perception, parenting behavior. Autism is a spectrum disorder which is characterized by social and communication impairments linked to significant defects in oxytocin system. Decreased NAD affects CD38. With decreased CD38, you get decreased oxytocin release. So there's a direct relationship between NAD levels and oxytocin release. Let me go back. Let's see. Yeah, so that results in impaired social function. There's more study. There's a lot more study that could be done about that.
We have used oxytocin nasal spray along with the NAD and found some improvement in more of, we haven't done it in the kids, but we have done it in more spectrum disorder adults, and it has helped.
That's good to know. We have used, there are psychiatrists around using the oxytocin spray. I've used it in a particular scenario where a parent has lost a child and they're grieving, and they're having waves of grief. So the oxytocin spray can help mitigate that. You know, it's a short-acting spray, but you know, it can give some relief during those spasms of pain, of grief. Mm-hmm. This is something that we were seeing and not really knowing what it was until I talked with this colleague that I've been working with, Ross Grant, in Australia. It's pretty clear that there's some pacemaker neurons in the suprachiasmatic nucleus, a part of the brain, and what we've seen is that they are NAD dependent, and the NAD helps reset or is involved with the circadian rhythms. We have a patient right now whose brother was a Parkinson's patient who got about an 80% response from the IV NAD. He came because he was feeling a lot of stress, not sleeping well, low energy, and so forth. And we gave him his first 2 days of IV. He slept. He had the best 2 nights of sleep he's had in probably 6 months. And his energy's coming back. So we see this regularly. We also see people sleeping when they get the IV, if they've been in withdrawal, if they're addicted to alcohol or opiates. If I give it, like if our staff takes it or when I take the drip, it doesn't make me particularly sleepy unless I'm sleep deprived. So we see it having a positive effect on sleep cycles.
Didn't someone just win the Nobel Prize like today in understanding how this clock gene and this suprachiasmatic nucleus interact to make sure that we have the proper biorhythms in our body? I think that was this morning.
I haven't heard it, but I know they were working on it, and I'm not surprised. I would again, you know, we do know that there's an NAD cycle. There's some I think there's a peak in the afternoon and a peak at night, and also the sirtuins, it talks about SIRT1 and this clock valve feedback cycles as well. So NAD is involved in the cycling. And
so when you get out of your cycle, all the biorhythms out, your chemistry starts to change, and you start to crave or any of those kind of things, crave or accumulate bad endocrine metabolites that make you gain weight or make you too skinny, or then support your not support but to suppress your immune system. Seems like this might be really important for this clock gene.
Yeah, I think it is. But you know what happens is, as you study this stuff, the more you know, the more you don't know.
Right.
It just opens up more stuff. But anyway, we see this regularly. People's sleep cycles getting restored and having sort of the best nights of sleep that they've had. And they're getting pretty good doses of the IV NAD to do that. But even with when my wife she's my test subject, we were testing out the NAD patches. And I put a patch on her, and she hadn't been sleeping very well. It was about midday. She was the first one to try a patch. Well, she almost fell asleep going home, and so I had to drive. And I knew that that the patches were getting in.
Mm-hmm. And we will talk about those later and how to source the patches. Might be a good starting point for some people.
Sure. Sure. All right. Then I have, as the levels oscillate the circadian cycle, you got oscillations of the SIRT1, and there is an epigenetic mechanism linked to the circadian clock. And again, these dysfunction has been linked to sleep disorders, depression, bipolar, changes in cognitive function and memory formation. I'm going to move on from this one. Well, basically, this slide says as you get older, you have structural degeneration, and you get increased telomere shortening. Now, oxidative stress is an important concept that it's just part of living. When you have any kind of metabolic activity, you're going to have oxidative stress. But it reflects the imbalance between the systemic manifestation of what's called reactive oxygen species, or RRS, and a biological system's ability to readily detox these intermediates. So as you produce oxidative stress, you've got to deal with it. And I can show you some slides related to how NAD helps. This ROS is a byproduct of oxidative stress. You get free radicals where you have one unpaired electron. It's like a bull in a china shop, just wreaking havoc with the other molecules. This is an example of that. You got the missing electron. And it's very harmful. ROS is very harmful in big concentrations. So you need a delicate balance between the generation of this state and the elimination of this reactive oxygen species. Free radicals produce cumulative tissue damage and major damage to DNA. So that's the higher the rate of DNA damage, the faster the aging process. And again, NAD comes in by helping to reduce the oxidative damage, pick up those hydrogens and get them out of there, and convert them to energy, and also helping the PARP enzymes to repair DNA. This is a slide on brain oxidative damage age in NAD. As you get older, you have more oxidative damage. This was the Australian group that I was telling you about. They have they looked at an isoprostane cerebrospinal fluid measurement as a measurement for oxidative damage. They also measured IL-6, which is a marker for inflammation, showing that as you get older, you have higher levels of that. They also looked at cerebrospinal fluid NAD levels, and they used NAD-NADH combination in their measurement, and showed that the decline when you get over 45. And they also were able to show that there is a correlation between plasma NAD levels and cerebrospinal fluid levels. That's part of why we like to measure plasma levels. We're trying to hopefully make some sense out of what somebody's levels mean. We haven't been able to do that yet. We've got a lot of samples to measure before we can get to that. Basically, this is a slide showing that NAD increases telomere length and explains how it does that. All right, conditions in which NAD can be depleted: increased oxidative damage, and this is a experiment done with mice showing as you increase with age, you increase your DNA damage, which increases your PARP activity, and you decrease your NAD levels. This is a study showing effects of alcohol on the brain and inflammation. And it showed, basically, this is, again, the Australian group that I work with. They showed by measuring cerebrospinal fluid NAD levels. After the first drink, your level is okay, but after the second drink, your NAD levels begin to drop. Again, you need that NAD to metabolize the alcohol, and your levels begin to drop. And so if you drop in NAD levels in the brain, you don't have much available to do other things that's important in the brain.
So I can hear it now, Dr. Medier. I can hear it now. It's, well, first you took my cheese away, and then you took my bread away. But I'm not giving up my beer or my wine.
That's right. That's right. Well, it's very well documented that alcohol is just not a good drug. It's not really a good drug.
Yeah.
These are conditions which NAD can be depleted, increased oxidative damage. Basically, we've gone over that. Alcohol intake, again, in the brain, the cerebrospinal fluid lower after the second drink, your alcohol level drops. Inflammation also goes up after your first drink. Inflammation in the brain goes up. This is alcohol effects on again, astroglia cells showing increased oxidative stress, lowering NAD levels, increased PARP activity, decreased SERT activity with increased alcohol.
Let's slow down right there because these two pieces are really important to my crowd. And what is an astroglia? I don't even know what that is.
That's a brain cell.
Okay. So there are things that, this is called, you said it was a neurotransmitter. It's also something called a glia transmitter, providing energy for the brain to pulse and move and grow and replenish itself, I think. So my question is, this is the big find, because people who have Lyme or autism or other things are self-intoxicating from impaired methylation, genetics typically, MTHFR, COMT, those type of issues. And they make an alcohol or an ammonia or an aldehyde that intoxicates these same brain chemicals, even just as if you were drinking. So,
well, yeah, that's interesting. And again, this is measuring the effects of alcohol, all deleterious.
yeah, and they're self-intoxicating and can't help it.
Right, exactly.
So keep on going. But I just wanted to point that out. It's in the glia that may be the damage.
This is I'm going to sort of summarize this slide. Basically, if you cut a nerve, the nerve dies. But if you pre-treat that nerve with NAD, it lives a lot longer. And that's why I've told my kids, if I have a stroke, I want you to be giving me IV NAD, or have the doctors do that, because it helps prevents the death of neurons in some cases. All right. This is one of the studies we did a couple of years ago, showing how when you give IV NAD to alcoholics or opiate addicts, you significantly reduce craving. This is day 1 to day 10, a dramatic, statistically significant reduction in craving. And that's what we see generally, and that's why we keep giving IV NAD in the detox, because we can eliminate the craving, at least for a while. Now, if they go back to the cues and a lot of the triggers, they need to continue in a program to maintain NAD levels to keep those cravings away. And the other thing we learned is just eliminating cravings isn't enough. You've got to treat addiction as well. I mean, rehab's involved, therapy, aftercare, AA, smart recovery, all those things are important.
Or living well today's excellent nutritional program to stop cravings.
Yeah, and again, I'd be interested how that's doing what it's doing. So this is a slide showing cravings were still reduced after 12 to 20 months. Not as dramatic as by day 10, but it showed a significant reduction in cravings for alcohol and opiates out to 20 months. Also, we showed a rather slight, not the robust relapse episodes that you would normally see. We saw a decrease in what you would normally expect in terms of relapses. There's still relapses associated if they get detoxed with IV NAD, but most of our patients come back pretty quickly, and we help reset them, and sometimes the second time's a charm, sometimes the third time's a charm. This is about isoprostanes, which are prostaglandin-like compounds, we use them in our lab to measure their byproducts of oxidative stress. And what we're measuring is this 8-isoprostane, and I'll show you some of the pilot data that we have now. This is measuring 8-isoprostane in healthy, age-matched controls and sex-matched controls versus 26 alcohol patients, alcohol abuse, and 19 opiate patients. And then we had 3 draws during their 10 days of IV. There was a baseline before they started, and their marker for oxidative stress was up, and it came down by the second draw, and then sort of leveled off for the alcohol patients and continues to go down in the opiate patients. So we're seeing a definite reduction in oxidative stress markers in our detox of alcohol and opiate patients. This is it's a measure of inflammation showing a response, a reduction in inflammation using the IV NAD.
Hey, Doc, I've got a good question for you.
Yeah.
Is there any correlation between opiate addiction and sugar addiction? And therefore, can a sugar addiction be helped by treatment with NAD?
Well, you know, I've talked to a couple of groups recently about that. I don't know. You would think theoretically it would be there, but I can't say. I mean, we see people when they come in, they're pretty malnourished because of their addiction, and we see their appetites go up and they gain weight, and then they sort of stabilize. We've never really addressed a, quote, sugaraholic, but I know that there's some research in the addiction world that can correlate. There was a research project with mice where they were, I guess, transgenic mice who were addicted to sugar and had never had any opiates. And when you remove the sugar, they would have withdrawal that mimicked opiate withdrawal, which was kind of an interesting experiment. It's something to be tested out. I don't know. I can't answer. This is also our pilot data to show a rise in NAD and ADH levels in alcohol patients on draw 3, which is the last day of the treatment. You can see a rise in that NAD and ADH level. You see a rise in NAD as well, and a sort of a drop in NADH. See the same thing in opiate abuse. It's that third slide over, or the third figure over, that shows the NAD and ADH ratio going up. I think that's what's very significant. This is a case of a pilot who was getting his license renewed. We had treated his son for alcohol addiction, and his son had gotten a really good response. His memory improved and so forth. And this pilot wanted to be sure and get some IV NAD before he took his license. And he was fairly compulsive, and he had done some luminosity. So we measured his luminosity on day 1, and then gave him 5 days of IV NAD, and everything improved, and he ended up passing his test. So that's just a little small pilot.
We have the same experience. We have a pilot that certifies other people, and has Lyme disease and was losing the ability. She was losing the ability to teach and see where she was. And after she started the NAD Myers kind of approach, she was able to land and take off a lot better, and kept her certification. So we did have exactly that too.
Yeah, you bring up an important point about when you mention the Myers. NAD is such a synergistic molecule. I mean, some people are using it with hyperbaric oxygen, showing some effects, using it with phosphatidylcholine. There's a synergy with it for lots of things, and that's the interesting part for others to delve into. And see how we can use this molecule with other supplements and other ingredients. What research is still needed to be done? This slide probably has expanded since I've done it, but we need to know the best dose regimen, how much and for how long, for how many conditions, in any of the NAD enhancing substance. That includes the IV, the nicotinamide riboside, the NMN. Are there any combinations of treatment molecules that may enhance the NAD effect? Wait. Need to assess the effectiveness of NAD therapy alone and in combination with other strategies. I think it's important in addiction medicine, neurodegenerative disease, depression, chronic fatigue, PTSD, traumatic brain injury, metabolic diseases. We've had a fair number of cases of traumatic brain injury get a response, somewhat dramatic. On our website, the Springfield Wellness Center website, if you go to that website, there's some testimonials on there, and there's one guy with a patch on his eye that had, and still gets a dramatic response. He qualified for CTE, or chronic traumatic encephalopathy, the illness you see with football players, and he was a football player and had multiple concussions. He's gotten a tremendous response and is doing really quite well. So I guess, are we open for questions, or do you have any?
Sure, we're open for questions. We got a number of people in the room, but Aaron, tell me if there's any questions. We've had more people join us than we have leave us, so that's interesting.
Now's the time. If you have any questions for Dr. Medier or Michael Payne, please ask them in the question box.
So while they're lining up, I just want to say, Dr. Medier, thank you for showing us the background. And I'm just, in less than a minute, I would like for you to say, you came to Heal the Healers, and Dr. Medier was great and came and spent time with us. What did you think of that weekend? I mean, a lot of us had a lot of great ideas. What did you find fascinating about that weekend?
Well, the thing that I felt the most was interested in is the combination of the photon energy work that you're doing. Mm-hmm. And again, that's a synergy that needs to be flushed further out, because the NAD provides sort of I guess the photon energy supplies the current for the mitochondria. The NAD supplies the battery acid, more or less. So that combination, I think we were seeing better mitochondria function, better cell function as a result of better mitochondria function. And that's an area that, is just wide open to me.
If I could get to San Diego, you're going to let me talk about it, aren't you?
Oh, yeah.
All right, there are some questions.
Okay, let's go.
First, do we know anybody in the New England area that is doing this? NAD or PD?
No, well, in Baltimore, there's Dr. Liz Stuller. She's really excellent. She's a psychiatrist. There's a Dr. Holland Chin in Manhattan, and there is I just got a request from a person who I didn't get to call back today from Manhattan, who is interested in training as well. Dr. Chin, Dr. Holland is his name. He works with stem cell work, but he's also doing the NAD.
Or you could just come to Richmond, Virginia.
Right.
All right. We also have another question about how do we know when we have enough NAD, and what's its half-life?
That's a good question. We see, when I talked with the South Africans years ago about what their experience was, they told me that once you give an IV, you can expect about a 3-month, window, and then it begins to decline. We see some people utilizing what we give, and they may need some more in a month. All of my observations are clinically based. So when somebody gets a response and they begin to lose that response, and then we resupply them with NAD, and they get that response back, that's basically the paradigm we use.
One time you said that we wished that we could just bathe the cells in it for 10 days in a row, like all the time, 24 hours a day for like 10 days, just to make sure that the permanent, that there might be a way to permanently change it. But I think stress and the use of it probably, we've seen is 2 to 3 to 6 months, you know, really good things. It keeps unfolding. What about that? It seems like even after you give the IV, the benefits continue.
Yeah, a couple of observations that are interesting that I don't understand. One is, you know, we can give an IV and 2 or 3 days later you're getting the response from that initial day. So we see a cumulative effect. Something's getting turned on that's getting turned on that's turning something else on that's turning. And so we'll see people leave at day 10, let's say, with a certain level of craving, and then 10 days later, even better, feeling even better than when they left. The other thing we see is that when someone's had the IV NAD, and we give them, for whatever the situation is, and they have the exact situation 5 years later, and we give them the IV NAD, they need about half the amount that they would need otherwise. So there's some memory in there, or some system that's paid attention for the IV NAD, I think.
Mm-hmm.
Okay. Can you also comment on, and like compare the effectiveness of the IV application versus the nose spray or the patches?
Well, the IV is sort of the gold standard in that. We're liking the patches a lot. We're using the patches. I'm using the patches myself. I'll put it on a joint that's bothering me, and it actually seems to help with pain. That might be placebo, but that's what I'm observing. And it does help with levels. We've measured levels go up in plasma with the patches. The nasal spray is fairly convenient, though, and you do one spray in each nostril. You feel a subtle effect, or sometimes a robust effect. And our addicts will use it when they feel a lot of craving. They've gotten exposed to a trigger. They'll use the nasal spray because it's quick, easy, and you can do that again an hour later, or even you can do, some of them do 4 different sprays a day just to keep their levels up.
We have experienced quite a broad range of benefits from the patch. The patch, though, it does get a little irritating after a while, so you have to move it around. And it's not your, it's not the typical patch. It is a medical patch used in medical procedures with electronics in it that actually deliver through, you know, certain structures of your body the actual medicine. They use it a lot in pain management with heavy drugs. So Dr. Metier and the team in Louisiana got together and said this might be a right way, and so they measured it, and we've had people with from say mold and ADD and depression to people that had interstitial cystitis, which is always hard to say. She's actually been the biggest one. We haven't even talked to her for a while, but she's done about 18 to 24 patches 3 days apart, so that's 72 days, and 80% of her pain is reduced.
Yeah, well, the way we use the patches is we help, for the heroin addict who comes in day one, they're gonna be in withdrawal, you know, later in the day, and they don't get into withdrawal while they have the IV. But when they leave, their withdrawal frequently will come. It won't be as robust as otherwise. But we use the patch to help get them through the night. We also have a subcutaneous, like an insulin shot that we use to help them maintain their levels until the next day when they can get a second IV.
Mm-hmm. And we have done that here as well, just in the neurologic. So in the neurologic things, I just want to reiterate in that August lineup, there were so many great successes. We had a young man that's got turned upside down with mycoplasma in his nervous system and a few things, and it really, he did 5 days of NAD, plus then he did the patches, and then he did the neurophotonics that we've created here, and he was out having a social life, pretty good, and getting ready to take his GED and go back to college. there was a early mumbling pre-Alzheimer kind of condition, now can drive back and forth to New York. You just start naming it, and it was just kind of fantastic. And one of them was really, if you stack the IV the right way, it acts as NAD acts as a precursor to other, as you said, nutritional issues, and it's helped with CMV. I'm sorry, CML and CLL as well. So that's what we see, and that's what has occurred since August. Go ahead.
Yeah, there were some amazing results there, and I do think the photon energy plays a role. The mitochondria, focusing on mitochondria health is important in all of those.
Mm-hmm. What Dr. Metier, if this is the first time that you've joined us, we built with partners of retired engineers from NASA, that we built something called a qubit, which is quantum infusion biotechnology, or quantum bioinfusion technology, qubit. And so you can see that on our website somewhere, and Aaron will tell you about that. We also used got together with the guys from Hemolumen, Neurolumen, Multilumen, and we've built something called the Neurolumen, which I think helps that glia or astroglia issues in the brain through pulsed 35 milliwatt light surrounding your brain. So not low-level magnetic therapy, but biophotonic. Even Boston College and Mike Hamlin at Harvard, who's now retired, going back to Britain, they created a whole new department at Boston College called neurophotonics. And we do believe that area of the brain is helping, we're watching the modulation of the neuroimmune system go there with the energy of the NAD molecule. And our dear sweet Amanda, who is part of our staff now, came for 2 months and only used the neurophotonics, doctor, and then she finally did the IV. So, and she got better and better and better. She does cycle around, but she just kept getting better over the past 4 months just doing neurophotonics.
Can you comment on how NAD can possibly help with PANDAS or adrenal fatigue?
I don't have any experience with that. It might help to repower the adrenals a bit. Certainly, it may help in the pituitary gland to, again, help repower the adrenals. But I don't have any experience with that. So
well, I'll give a little experience. The ATP molecule helps us. So we all sit out here, and I know you don't. You've been spending the last 15 years studying this molecule, but we give a lot of adrenal cortex, and we give all those kind of things, and it seems to be, well, it's part of then do this medicine. If this happens, then do this. We're not really rebuilding anything. ATP, if set in motion, really helps that entire process. Now, Aaron, did you say PANDAS as well?
Yes, PANDAS.
Well, PANDAS is a different story, so you'd have to combine something with that, either oral or some people use antibiotic, of course, some people use IVIG. But yes, it's some...
Actually, this is another conversation, but the Neurolumen would probably be the best thing for the PANDAS.
Oh, the Neurolumen would be fantastic, because PANDAS is... what happens is, if a lot of you don't know, strep or other, and I don't think it's just strep, and they put that in there, but I think a broad range of bacteria can migrate inflammatory cytokines through the blood-brain barrier and into the cingulate and into the basal ganglia. It makes usually the child, but we've seen it across the board now. It used to be just children that had PANDAS-like behaviors or autistic-like behaviors but weren't autistic. So what that does is cause an inflammatory TNF alpha cytokine. So the answer is yes, but it wouldn't. NAD could be perfect for that, but I think we'd have to have an immune modulator or an something anti-infective that would help us, because it's basically a broad range, not just strep, but a broad range of infective, harmful pathogens that leak through the blood-brain barrier and cause inflammation in the basal ganglia and the cingulate. So, but NAD does work, but it needs to be combined with other things.
And you don't always, I have another question here. There's other ways to administer it other than IV, and one of them is using a patch. a powered patch that I think it works through reverse osmosis, right? So
it's called the ontophoretic patch. It was developed in the physical therapy world to deliver steroids or like dexamethasone for a joint or something. It's got a little battery in it, and it's got a positive side and a negative side. For us, we put the NAD on the positive side. It's a 400 milligram per cc delivery. You get about a cc, a milliliter on that side, and then you put normal saline on the other. And as soon as you connect take the adhesive off and connect it, the battery's on, and it can be on for 4 hours, 8 hours, or 14 hours. We use the 4-hour or the 8-hour patch.
And so it's fantastic. It's just some people's skin are a little sensitive, but in order to get that, you need to have a consult with our team, you know, and a rapid consult if you're already a patient, and then we can prescribe it. It is a prescription.
Right.
So it's fantastic, in my opinion, in about 70% of the cases or 60% of the cases. It's a great starting point.
I have one person on here said, someone who's used it here said definite improvement with the NAD, but they want to know how often and how much NAD is needed for sub-Q injections, and how much they would need for autoimmune and neuroimmune issues.
Yeah, that's it's hard to know. You know, again, you use clinical response. I've had some people do 2 injections a day. It's 100 milligrams that you can usually get into a sub-Q injection. But some combination of sub-Q injection and patch, or sub-Q injection and nasal spray, those are all, you know, it becomes an art form a little bit, and it becomes based on clinical response.
Mm-hmm. And some of my impaired methylation people, and this is a big crowd that knows about that, doctor, you know, some of them are very sensitive. If you start to rev up the methylation cycle at any level, they start dumping toxins or ammonia or things like that, get very ill. So we have to start low and go slow. Right,
right. There is a theoretical concern with, you know, if you have a double. What we've seen is if you have a double SNP MTHFR, double SNP, you're vulnerable to some hypomethylation effects from the NAD after probably about 5 to 6, and we're doing it over 10 days, 5,000 to 8,000 milligrams, and you may get some fatigue that could last for a couple of days as a result of getting too much NAD. That's the only real questionable side effect that we've seen long term, lasting a couple of days of fatigue from too much if you have methylation, big methylation issues.
Okay, Aaron, another question?
No, but what have you seen with concussion recovery?
Yeah, we've seen some interesting positive response. There was one of the guys doing the NAD had a stroke patient that he gave the IV NAD in a hyperbaric chamber. I don't know how he rigged that up, but he's a MacGyver kind of guy, and got a great response.
I've been thinking about that.
Yeah, no, I would definitely, if it were me, I'd definitely want to use it because it helps to repower the neurons. You know, it helps.
Okay. So as we, Aaron, any more questions?
Does anyone else have any questions for tonight?
They're all good questions. You can watch it and reread it and rethink it, and we're here. The one thing that I want to remind you, it's probably time to get rescanned because all of this information is in the scan, whether you know it or not. We look at the suprachiasmatic nucleus. We look at all those kind of things just to see if there's stress in those areas. It's time to rediscover what we do here with neurophotonic biophotonic, because we worked really hard on it the past 3 years with a lot of intelligent people, and anywhere from pandas to neuro immune dysfunction, meaning autism, Parkinson's, MS. Alzheimer's is a little bit different, but those kind of things can be supported in a healthy way, not just taking a then do this medicine and not really looking at the underlying cause. For most of you who have Lyme disease, it's always a battle. We did train in something called Lyme N treatment. I suspect that it would go better if we supported you with NAD in order to get real high quality. And doctor, would you just say one thing real quick about the quality of the NAD that we do with the Archway?
Yeah, that's something we spent a lot of years working on. We worked with 4 different products, and the Archway product's clearly the best. We get benefits at much lower amounts that we have to use, because I looked at all the certificates of analysis that come out, and theirs is 100%, 99.9, 100.1, and they do a independent analysis of every batch. And I look at that. They're very, very good at getting high quality NAD. You can get NAD that's of less quality, but we don't use that because we notice people have a little more side effects with it in terms of tolerability, and they don't get as a response as quickly and as robust as with the pure. So I think it's important to use the purest product you can get.
So we're excited that you have helped us for this past 9 months, and we're really appreciative. We've started to see it in a very effective clinical setting. I think you enjoyed your time here in this clinical setting, and I won't call them toys because people go, well, you have such cool toys, but it really isn't. It is a systematic rebuilding of energy in the body that allows you to heal yourself. So if you are so inclined, call us and ask us about our 1-day program, our 3-day program, and our 10-day program. And,
we did have one more question pop up.
Okay, go.
It says, the brain information, the NAD, this is another person who's had NAD in the office. It said it helped with brain inflammation, better focus, how about the NAD for neuropathy and over-electrification of the nervous system?
Wow, good question.
Yeah, I don't have any experience with that. I have had some people that have had injuries, and the injuries were quiet, and you give them the NAD and it activates, and if they can work through that, it might help to heal. But I had one patient who had a I don't know, maybe 3 or 4 nerves removed from his scalp because it was stimulating migraine, and his migraines went down. We gave him a little bit of NAD, and it activated those nerves, and it activated his migraine. So it's definitely going to activate. It's going to activate nerves that are maybe quiet. But what I've found is you work with that, and you go through it, and then it helps to promote healing.
Okay.
Well, isn't it basically what it comes down to? The NAD is restoring the mitochondria function, so it's going to give our bodies the energy it needs to actually repair itself and the underlying subtle energy of our body.
Correct.
Do you think it could activate nerve memory from a trauma?
I don't know. That would be an interesting thing to look at.
Okay. Are there any more questions tonight?
And then you could bring it to a close, son.
All right. Well, thank you all for joining us. I would just like to point out that here at Living Well today, we are offering NAD IV along with many other IV treatments, along with Myers cocktail, vitamin C, curcumin, artesunate. Lots of different treatment options here are available now. And give me a couple days, and I'll have this posted on our website, so you can go back and listen to the presentation again. Please feel free to give us a call tomorrow if you are interested or in coming down here and getting some treatment. Our phone number is 804-562-8554. And I'd really like to thank Dr. Medier for joining us tonight, and all of you. Have a good night, and please give me a call tomorrow, and we'll get you set up with your NAD treatment. Thank you.
You're welcome.
Thank you, doctor. Good night.
Night.
All right.